very good morning, Apollo family. Apollo 24/7 brings you this wonderful show called Health Hour every Sunday. We bring you an Apollo's expert to talk to you and clear your doubts that you wanted to ask and you've been postponing that visit to the clinic. And here we bring you an expert where you can talk everything about heart attacks. What are the reasons? What can be prevented? How do you check yourself? How do you track yourself? Everything is going to be covered today. Please join us in the live session and ask all the questions. We are going to bring in a very expert, a senior consultant cardiothoracic surgeon who is going to join us very shortly. Dr. Mukesh Goel will be joining us. Please ask all your questions only on the YouTube, wherever you must be watching this. But please, if you want your question and query to be answered, join us on the YouTube chat and please type your question in the chat box itself. Well, also on the show, there's a quiz coming up, health quiz, where you can win gift vouchers from Apollo 24/7. Also, we'll be giving away discount vouchers and coupons. Please stay with us towards the end. We're going to give all of these away. आज के टॉपिक इंट्रोड्यूस करती हूँ. हाउ डू वी प्रिवेंट हार्ट अटैक्स? क्या होते हैं, किस किस को ये रिस्क है, और हाउ डू वी प्रिवेंट दिस? Let's invite our guest today. Dr. Mukesh Goel is going to join us. He is a senior consultant cardiothoracic surgery at Indraprastha Apollo Hospitals, New Delhi. He can be consulted for heart and lung transplant. He has experienced more than 21 years. Professional memberships है डॉक्टर साहब के. He is a fellow of Indian Association of Cardiothoracic and AMP Vascular Surgeons, life member of European Association of Cardiothoracic and AMP Vascular Surgeons, international member Society of Thoracic Surgeons USA. Good morning, Dr. Mukesh Goel. Welcome to the show.
Yeah, good morning, Jhansi, and good morning, viewers. Very hearty welcome
Yes,
for joining us on this Sunday.
And I should thank you that you are here with us on a Sunday morning. We understand how busy a surgeon can be. No Sundays, no Mondays. So thank you so much. We appreciate your time this morning, Doctor.
Thank you, Jhansi. Thank you.
डॉक्टर मुकेश, आज मुझे ऐसा लग रहा है ना कि मैं एक वास्ट ओशन के सामने खड़ी हूँ, एक छोटा सा बोल लेके. आई हैव अ ट्रांसप्लांट सर्जन, आई हैव एन एक्सपर्ट कार्डियोथोरेसिक सर्जन, एंड मैं आपको बेसिक क्वेश्चंस पूछने जा रही हूँ, and that should help our viewers. I hope our viewers will be understanding that you come from a greater expertise than what you're speaking today.
Jhansi, we may call it basic, but it is basic which matters actually. And rest is a technical and other jargon, but basic is what will make us as a society a healthier society, and will bring down the disease burden on our society and community.
Very well said, Doctor. We understand the kind of responsibility that your entire fraternity holds towards bringing down the burden of disease. Thank you. And let me start with the basic question. I see a lot of people are, good morning, Ismail Akhtarji and Vasanti. Everybody is joining us. I will be taking shortly the questions from YouTube, Doctor. But before we start, let me again ask you, can we describe what a heart attack is? क्या है heart attack?
So, heart attack is the condition when a blood supply to a portion of heart it is interrupted. So, the area where the blood supply has been interrupted, that muscles in that part, the heart muscle, they start dying. So, this phenomena is called heart attack, or in medical term, it is called myocardial infarction, acute myocardial infarction, acute MI. So this is what we call heart attack. Yes.
तो ये जीता जागता एक ऑर्गन है जो रिलेंटलेसली, रेस्टलेसली जो हमारे लिए काम कर रहा है, तो पार्ट ऑफ इट मे डाई is what I understood from.
Yes, yes.
But there are people who survive from heart attacks is what I heard, कि एक उनका पहले ही दौरा पड़ चुका है, ऐसे भी बोला जाता है. वो क्या होता है?
See, now it depends कि जो पोर्शन है हार्ट का where the blood supply has been interrupted, वो पोर्शन कितना बड़ा है. It is like 5% of the total heart area, 10%, 15%. So like when there is a 25% or more is involved, that is called an extensive or a massive MI, myocardial infarction, and that is almost always fatal. but generally 5%, 10%, these kind of areas are affected. And many times what happens that the blood supply is interrupted, but there is some blood flow which keeps going in between. So what we
जी.
call minor heart attack or pre-heart attack. So there are many
Okay.
variations in that. So it
Okay.
depends that what will the extension and of the heart attack which is happening actually.
Okay, okay. Now I see a lot of people have started typing their questions. Dear audience, please bear with me. I'm going to take your questions in a while because I'm waiting for a lot more people to join and ask their questions so that we can combine the questions and give the best answers, Dr. Mukesh. Yeah. And one quick question again, जो हम लोग काफी सारे terms use करते हैं heart attack के लिए. Basic term है heart attack. बट कभी कभी कार्डियक अरेस्ट के बारे में हम लोग सुनते हैं एंड देर आर अदर टर्म्स ऑल्सो टू डिस्क्राइब ये क्या डिफरेंस कुछ डिफरेंस है क्या दोनों में
So cardiac arrest is when the heart stops. So it is no more pumping, and
हम्म
the person will die within 5 minutes actually, because if the blood supply to brain is interrupted for 5 minutes, so the
ओके
brain dies, and with that the
राइट
person dies. And
जी
heart attack is when a portion of the heart stops working because of the interruption of the blood supply, and a portion of the heart muscle is dead. So, heart attack is itself a major cause of cardiac arrest, but all heart attack will not lead to cardiac arrest. Like maybe 3 to 5% heart attack, they can lead to cardiac arrest.
राइट राइट सो अंडरस्टैंडिंग दैट हार्ट अटैक से
Ha-
लेकर इट कैन लीड टू
yes,
अ कार्डियक ओके सो
see, you
बेसिकली
can
द
look at it like a heart attack is like a injury. किसी की हाथ टूट गया, पाँव टूट गया, लाइक इंजरी हो गई है ना, बिकॉज ऑफ सम
इंजरी
एक्सीडेंट और सम इंजरी. And cardiac arrest is like death of the person. The whole person has just
हम्म
died. Yeah.
हम्म Right. So, also asking you the other terms, just for my understanding. कि somebody is asking, sir, gas pain and heart का जो नाता है, जो connection है, lot of people have a confusion कि ये, you know, RP is asking, what is a left arm pain? Does it always mean heart issue? How do we differentiate between gas related and pain in the heart? फर्स्ट एंड फॉरमोस्ट गैस्ट्रोएंटरोलॉजिकल सिम्टम्स के साथ हार्ट अटैक के साथ पैनिक भी होता है देन देयर इज अ पैनिक अटैक and recently also I've been reading about an article which also deals about broken heart syndrome. So can we differentiate between these three, doctor?
Um, so many people who experience bloating in their tummy while they are taking food, or they are experiencing that there is a lot of gas, sore eructations, and acidity like feeling, and especially when they take food, uh, which starts with food basically,
जी
not the empty stomach. So these patients might be experiencing angina, and they might be having issues there with their heart. So these
okay
persons should get a heart checkup and rule out whether their symptoms are happening because of the heart issues.
जी
Sometime a heart attack itself can present as a persistent symptoms in the tummy, and if
हम्म
the symptoms like they do it lasts for more than half an hour, and you have taken whatever remedy, home remedy or over the counter remedy, you have taken antacid syrup and pudin hara, whatever you have tried and you have been trying earlier, but it is not relieved. So please go to an emergency, to the hospital, and rule out a heart attack.
So it's always better कि ये gastrointestinal, even if it is a simple gastrointestinal, it's better to rule out something related to heart
Yeah, with
and
the
then
heart, yeah, we
back
should.
to gastrointestinal. That's what Dr. Mukesh is
Yes.
trying to tell us.
Yeah.
Yes. So that's a very, very valid statement, doctor. Whatever is larger, if it is looming behind, we should address it first and then address the other issues. So, one quick question. There are also people who have the anxiety and panic attack. How is it different? And the article that I was reading the other day about broken heart syndrome, how are these two different?
So, panic attack basically is a psychological phenomena. So some people, they are prone to have a panic attack because of their personality, and which is like obviously they can't help it. So in panic attack, all the symptoms like palpitations, sweating, fearfulness, and all these things will happen, and the heart may be normal. Okay. So, obviously, if it has happened first time and the person is being consulted in an emergency situation, so the doctor has to rule out heart attack basically. But if the heart attack is not there, like we do what blood test, we do ECG and other tests, and we found that heart is normal. So then we label that obviously it can be a panic attack which has happened. Okay. So a broken heart syndrome is basically a medical term nowadays. It's not a non-medical term now. A broken heart syndrome will lay whenever there is like heart is to begin with is normal. The coronary arteries which are supplying blood to the heart are normal. There is no predisposition to have a calcium or cholesterol which can lead to cardiac arrest, heart attack kind of a thing. So heart is begin to begin with is normal. Okay. So
Okay.
whenever there is an extreme stress, it can be emotional or it can be even a physical stress, like patient is in septic shock. Septic shock is when there is a infection in the blood. Whole blood is because of the bacteria toxins released in the blood. So these kind of situation, the heart function comes down. There is a stunning of the heart, what we call myopathy. Okay, so this is called broken heart syndrome. It may or may not recover after the stress is gone.
Right. So these are two completely different terms, and we understand
Hmm.
panic attack is non-dangerous and broken heart syndrome can be
Is
dangerous,
dangerous.
and that has to be evaluated only medically.
Yes,
And it's a
yes,
medical term.
definitely.
Wow. Thank you so
Yeah,
much for
exactly.
that.
Hmm.
Yes, doctor. So, with that we have established कि क्या heart attack है, क्या cardiac arrest है, क्या panic attack है. Now I want to understand the causes. What are the reasons for a basic reasons that can cause heart attack?
A very valid question in today's time, because once we know the cause of the heart condition, then only we will be able to do something to prevent it or treat it. Hmm. So first, there are what we call risk factors which are make a person more predisposed to, more prone to have a cardiac disease, heart disease.
G.
So what are there are some risk factors which are non-modifiable, which are not in our
Mm-hmm.
hand, and we call
G.
them fixed risk factors. Then there are risk factors which are because of the lifestyle we
Exactly.
lead, and we call them a lifestyle risk factors or environmental risk factors. And these are the factors which we can do something to modify it. So fixed risk factors are like age. As we grow older, we have more prone to have a heart disease. Men over 45 and women over 55. So they can have cardiac issues. Likewise, male gender. Men tend to have more heart disease compared to women. And
Acha?
third is, yeah, and third is family history. Like if
Okay.
you have a first degree blood relative in the family, you got a heart disease at a younger age. Like if someone's grandfather has a heart issue at 80 years of age, that is not considered a positive family history. Like at a
Correct.
younger
Correct.
age, around 50. So
Yes.
that person will also be more prone to have heart disease and should take extra care.
Mm-hmm.
Then genetic factors are there, like people of Indian subcontinent, the whole Indian subcontinent, right from Afghanistan to Burma and Sri Lanka, Nepal, Bhutan, all this Indian subcontinent. We in the world we have a highest incidence of heart disease because of the gene factor in us. Compared
Seriously.
to Chinese, compared to Japanese, compared to Europeans, compared to Americans, we have the highest predisposition to heart disease. So these are risk factors which we cannot change. Now,
Correct, correct.
what are the lifestyle or environmental risk factors? First is high cholesterol level in the blood,
Hmm.
and especially the high levels of low density lipoprotein, which we call a bad cholesterol.
Okay, okay.
Second is smoking. Third is a sedentary lifestyle. Sedentary life, like majority of the people nowadays, we lead a sedentary lifestyle. Our old pre-industrial kind of a work has gone away. Like even in today's time, even farmers are not exerting that much physically, which they used to a long time back. Now all
Yeah,
the
the
machines have taken over the physical work, so you cannot even say that even the farmers are doing physical work
enough physical
to that
activity.
extent.
So let's
Yeah.
put it like we don't have enough physical activity. Though we think that we are working
Yes.
physically, that is not sufficient.
uh, no, no, like if I am working whole day and sitting in office, that is not a physical activity basically, though I
बिल्कुल
might be
बिल्कुल
working 12, 14 hours a day. And then weight, obese. The people who are obese, they are at higher risk. Then another risk factor is diabetes.
जी
And yes, and then stressful lifestyle. Not only the physical stress, but the even mental stress lead to long-term mental stress leads to permanent changes in the metabolism and lead to more cardiac disease. So these are
जी.
the risk factors which make one prone to have a heart disease.
Great. With this information, I think, Doctor, I should give our audience one very, very important tool in their hand. Ki a lot of
Yeah,
people have doubt ki, am I prone to heart attack? Am I at the risk of heart attack? With any of these symptoms that you have or any of these risk factors that Dr. Mukesh Goel has just now
yeah.
announced, if you have anything, Apollo 24/7 has devised a very simple 2-minute heart health tracker tool. And the link is given in the chat box. We are also going to place the link available in multiple places. Please go ahead, take this 2-minute quiz where you can track what is your risk factor for heart attack. So that's the link there. So, Doctor, let me continue with a question that is also from our registered user and also Mr. PB, who's asking younger people who are prone to heart attack. The number is increasing. Smriti is also asking, and the same question कि ये क्या है कि young people इतना susceptible बन रहा है. Recently, we have lost an actor, Siddharth Shukla, and also a year back, a very, very prominent Kannada actor, Shri Puneet Rajkumar, passed away. We are listening to this young generation who are really very fit. What is the reason behind this?
So, Jhansi, increasing incidence of heart disease and heart issues in younger generation, basically out of all these risk factors which we elaborated a while back, it's mainly smoking and stress, which are the two most important factor for early heart disease and fatality in younger generation. So the younger generation, they should keep away from smoking and including vaping, because vaping has other effects on the body and which can be very fatal actually. And
Yeah.
increasing use of drugs, especially stimulant, which make them work long hours, maybe give them more energy. That is another factor. And obviously, they are doing these things because younger generation is too much stressed nowadays.
True.
They want everything to be perfect, to get everything early, all very competitive, and always want to have more than others. So these kind of stress directly and indirectly by leading to more drug abuse, more smoking, it is making them prone to heart disease early in life.
Gee. All right, so that is a call for all of us to reduce stress and get back onto good and healthy lifestyle. Keep away from these. So, for all my Telugu audience, quickly, should I do that in Telugu, Doctor? Very important points and
Yeah,
valuable with your
definitely,
yeah.
definitely. Yes.
డాక్టర్ ముఖేష్ గోయల్ గారు ఇప్పటివరకు చెప్పింది ఏంటంటే హార్ట్ అటాక్ రావడానికి కారణాలు ఎక్స్ప్లెయిన్ చేస్తూ వచ్చారు. అది కుటుంబ నేపథ్యంలో వంశపారంపర్యంగా రావచ్చు, లేదా మన భారతదేశం దాని చుట్టుపక్కల ఉన్నటువంటి మన ఖండంలో ఉన్నటువంటి కొన్ని దేశాల వారికి జన్యుపరంగా కూడా హార్ట్ అటాక్ వచ్చే అవకాశం ఎక్కువ ఉంది. మగవాళ్ళు 40 దాటిన తర్వాత హార్ట్ అటాక్ ఎక్కువ రిస్క్ గురవుతారు. వీటిని మనం తగ్గించుకోవడానికి మన ఆహారము, మన లైఫ్ స్టైల్ అలవాట్లు, ఎస్పెషలీ స్మోకింగ్ లాంటివి, విపరీతమైన ఒత్తిడి వాటికి దూరంగా ఉండడము, ఎప్పటికప్పుడు హార్ట్ హెల్త్ గురించి ఒక చెక్ చేసుకుంటూ ఉండడము, ఇవి చాలా ముఖ్యమని చెప్తూ వచ్చారు. ఆల్సో యంగ్ పీపుల్ ముఖ్యంగా స్మోకింగ్కి అలాగే విపరీతమైన ఒత్తిడికి దూరంగా ఉండాలని డాక్టర్ ముఖేష్ గోయల్ చెప్పారు. థ్యాంక్ యూ డాక్టర్. దట్ వాస్ అ క్విక్ రౌండ్ అప్ in my language. I will start to take up questions from YouTube, requesting all the audience who are typing your questions, give us your age, your gender, and also from how long, maximum details possible in one question. Please do not split your questions. I'm not able to find multiple questions there. Doctor, here's Nitish Rawat, who's 36-year-old male. What does chest heaviness, palpitation, body pain, tiredness indicate, and how to treat it for better health? With these, I want you to explain the symptoms of a heart attack, how to identify a basic heart attack.
So there are two things, what we call angina, and which is basically when the symptoms which we experience when there is a uh, blood supply is less compared to the demand. So the symptoms we experience, but it is there, it is not interrupted, and the cardiac heart muscle is still working, but it is not getting sufficient blood supply. It is getting. And the other one is heart attack. So when the blood supply is totally interrupted to that portion, and that muscles in that portion, they start dying. So what is how do we describe angina? What happens, like whenever there is a chest heaviness, sweating, and tiredness while we start doing some work, which might be, which has different stages, that at what level of activity it comes. And the hallmark is, as soon as we stop doing that work, the symptoms, they go away. Okay. So this is called angina. So if a person is not able to, like, if a person is walking 2-3 kilometer daily, and then now he starts experiencing these symptoms when he has just walked 1 kilometer, so it means that there is a interruption of the blood supply, and he should check for symptoms. So this is called angina. The other is heart attack, when the heart muscle is dying. So basically it might come up while you start working, but it does not go away when you rest. It is still there, and if it is more than 20 minutes, it's there. It's like you might feel heaviness in the chest, or maybe somebody has put a huge stone on your body, on your chest. You are not able to breathe, you have sweating, you have extreme fearfulness, anxiety. And if the symptoms don't go away even after 20 minutes of resting, so it means it is an heart attack.
Okay. So symptoms, एक बार फिर से आप हिंदी में for the viewers,
Okay.
quick symptoms please.
So एंजाइना है जब चेस्ट के ऊपर हैवीनेस है, स्वेटिंग हो रही है, और घबराहट की भी फीलिंग होती है, एंड द सिम्टम्स दे चले जाएंगे जब आपने रेस्ट किया, आपने जो काम कर रहे थे आपने काम करना बंद कर दिया. सो इट विल 2 to 5 मिनट्स में सिम्टम्स दे विल गो अवे. वाइल हार्ट अटैक में अगर आपको, हो सकता है आप रेस्ट कर रहे हो तब भी आपके ये सिम्टम्स आए, या हो सकता है आपने काम कर रहे थे तब ये सिम्टम्स आए, बट आपने रेस्ट करने के बाद भी अगर 20 मिनट के बाद भी सिम्टम्स परसिस्ट करते हैं, रहते हैं, तो इसका मतलब हार्ट अटैक है, और एक इमीडिएटली एम्बुलेंस को कॉल करना चाहिए, या अपने किसी फ्रेंड को या रिलेटिव को बोलें कि मेरे को हॉस्पिटल ले चलिए, नियरेस्ट हॉस्पिटल, मेरे को लगता है हार्ट अटैक हो सकता है. हार्ट अटैक के पेशेंट्स को, विक्टिम को, एक बात ध्यान रखनी चाहिए कि उनको खुद कभी भी ड्राइव नहीं करके जाना चाहिए. ऑलवेज टेक हेल्प.
Always take help, yes. And these are two important things, doctor. As a person who's helping at home, or a friend or support system के अगर मैं हूँ उसमें, what should I be doing if I suspect that there is a case of heart attack or
Hmm.
any symptom there, or if
Hmm.
I'm the person who's going through, what should I be doing? What should be these two first reactions?
So the first reaction is to be aware that it might be a heart attack. That is the first reaction. Second is calm down, don't panic. Tell whosoever is along with you. If you are in office, you are at home, so whosoever is the other person, tell him that I am experiencing some heart issues. I am not feeling all right. Please either call an ambulance or take me to the nearest hospital.
Great. तो
Nothing
यहाँ
else.
मोनिका,
Don't do
या
anything else. Yeah.
All right. Momita Das, 37-year-old female है. Emergency measures to be taken during a sudden heart attack in case of no resource availability, if body temperatures is falling below 95. How alarming is the case? And what could one do in such case?
Uh, so, Momita, basically, body temperature will not fall in a heart attack patient.
अच्छा.
So, body temperature will only fall when there is a heart arrest, cardiac arrest. So, obviously, then everybody should have a knowledge of a basic CPR, like chest compression, doing chest compression, and but the most important thing is to get help and call ambulance or people. Uh,
Yes.
you are not supposed to do anything.
Okay, okay. So if you
Yeah,
are a trained, qualified CPR, if you have enough I mean
mm.
qualification to do a CPR, then can somebody do that, doctor?
No, no, he can start, but before that, please call for ambulance.
Right,
The call
right.
should be on the way. You cannot handle, nobody can handle single-handedly anything.
All right. So that's a great tip. Thank you. And always remember ki call emergency immediately in such cases and don't do
Yes,
anything there. Thank you, doctor.
yeah.
So here is Suraj's question. Suraj is asking, COVID ki wajah se, what is the risk that a heart is facing? And after COVID, there are a lot of other heart issues that we are listening to.
So, actually, COVID is earlier we thought that COVID is also basically causes pneumonia, and that is the reason that majority of the people who died because of COVID, they died because of pneumonia. But nowadays, especially COVID is not causing pneumonia. It is causing, it is affecting all the organs of the body. It is affecting heart, it is affecting brain, it is affecting our abdominal organs. So it is causing whole body inflammation basically. And heart is one part where it can cause inflammation of the heart muscle, which we call myocarditis. And another problem with COVID that it might cause very, very small blood clots in the very small blood vessels of the body, including lung and heart, which can cause
Yeah.
dysfunction of those body organs. So COVID
Hmm.
is basically affecting the whole body, and that is really scary about COVID actually.
G. So COVID and so what kind of tests that one has to undergo if there was COVID earlier? And is every COVID responsible, or are there people who have to be extra cautious about this? For example, I've undergone COVID. So what is my risk? How do I understand if I'm at risk?
So people who are otherwise are having risk factors which are there for heart disease, like diabetes, high blood pressure, blood cholesterol, and if they have a history of heart disease previously, and
Okay.
so and obese, COVID has disproportionately affected people who are overweight actually. And incidentally, with obesity comes high incidence of diabetes and high cholesterol and blood pressure also. So basically they are like cousins, all these things, they
G.
happen
G.
to stay together in a single person basically. So
Yes.
uh, so these are the people who are more predisposed to complications because of the COVID actually.
Right. So COVID agar hua hai, and if you're healthy, you might not need to worry as much. But if you have any other risk
Yes.
factors, you need to keep a watch on it and have a regular tracking. And that's where I
Yeah,
think
well said.
the heart health tracker, the tool should help them. And the tracker is still on your chat box. Please go ahead, take that 2 minute simple test and avoid a major event. So, Doctor, here's Ria Roy and also Vandana who are asking something similar. I'll put both the questions together for you. Vandana is asking about cholesterol and how does it relate to heart and how do we get the cholesterol down. And Ria is also asking how to prevent a heart attack, what foods help control cholesterol levels. This is the question for her mother who's 53-year-old. I Because the father, she lost a father due to heart attack
Mm.
and she now wants to be conscious with her mother's cholesterol levels. And a lot of people are asking me about cholesterol levels. I'll get the names as well, doctor.
So, cholesterol is basically a natural substance in our blood and in our liver and in our blood, and it is like one of the essential substance for the normal functioning of our brain and nerves actually. See, but the cholesterol has many fractions. The two main fractions are high density lipoprotein, which we call good cholesterol,
G.
and the other fraction is low density lipoprotein, which we call bad cholesterol.
Okay.
So the good cholesterol, basically, higher the good cholesterol, the more protected we are, and higher the bad cholesterol, the more at risk we are. So what this bad cholesterol basically does, that it gets deposited in the lining of the blood vessels, and then in that comes calcium, and then it starts producing what we call an atherosclerotic plaque. So
Plaque.
it yeah. So and slowly it builds up and causes obstruction to the blood supply through that blood vessel. And when sometime it happens that there is a small crack in that plaque, and then a blood clot forms over that, which leads to a total shut of the blood supply, which leads to heart attack then, or
Okay.
myocardial infarction. So this is basically a physiopathology, what we call.
So that's the
So the
relation between cholesterol अगर जो ज़्यादा हो गया and
yes,
टूट गया
yes,
block हो गया.
yes,
So
yes.
now that a lot of people are stating, for example, Mr. Nitin is asking कि उनका बाकी सब ठीक है but उनके LDL 47 year old है 67, no sugar, no BP, never smoked, but lipid profile तो ज़्यादा ही है. HDL 33, triglycerides 298, LDL 163. Do these help him? He's taking prescribed medicines. Is it only a concern for liver or is it also a concern for heart?
No, basically, not only his LDL is high, his HDL is low.
Correct.
And a good way to increase HDL, that means good cholesterol, is doing a regular physical activity. So we'll advise that first line of management is start doing exercise. Um, Exercise, I mean, for around 40 minutes of brisk walking daily. And brisk walking is basically at a speed of 5 to 6 kilometers per hour. That is called brisk walking, not a stroll like strolling.
टहलना
Uh,
नहीं.
टहलना नहीं है. Brisk walking has to be there, and at least 5 to 6 days a week. So that is one thing. And second, there are some foods which can cause this imbalance. So I'm not saying that don't touch this kind of food at all. Once in a while is nothing going to do and no harm. But we should be conscious that a regular intake of fried food, processed food, high sugar food, they should be avoided
जी.
in a routine manner. Yeah.
Yes. So
हाँ.
also the other medications which are prescribed for reducing cholesterol अगर वो ले रहे हैं तो they should be
तो
continuing.
उसके साथ भी, but see, that is a additional help, but that is not a substitute for doing all these lifestyle changes of doing exercise and taking care of the diet. It is not a substitute for that. Actually.
Perfect help, perfectly said,
Mm,
doctor. So, doctor,
mm.
here PB is asking a valid question, doctor. PB is asking if today echo, ECG, and stress test, everything is normal in a 30-year-old sorry, let me say quickly, 30-year-old female, how often should the female is also obese, and how is there a chance that they'll have a heart disease, and how often should they get the tests done, and what are the tests?
So at 30 years, she got echo and stress test, which have come out thankfully negative. But these kind of a test tell us about the situation at that moment. They don't these don't tell us about the situation in future.
G.
So what will happen to the future? And for future, we don't advise that you keep repeating this test. Basically, you take care of the risk factors. You measure your regularly cholesterol, you measure your blood pressure, you measure your blood sugar, and you do regular physical activity and avoid stress and smoking. So these are the things to be taken care of regularly. And you don't
G.
need a repetitive stress echo kind of a test.
Yeah. So here's Karthik and Akash, both of them are asking about stents. So Akash stent 10 years back, and he's all fine. Recheck कब करना है, and how long can he wait to get the rechecks done, and any other symptoms that he needs to watch out for. Karthik is asking, if already stented, can a person get a heart attack again?
So, first of all, after stenting, we don't do a routine recheck by doing angiography or other tests whether it is working or not. We do check angiography only we suspect that the person is again developing symptoms of heart disease, angina, or kind of a thing. Okay. Otherwise, the same thing applies, like regular check for cholesterol level, blood sugar, blood pressure, and diet control, and no smoking, avoid stress. So these kind of a things, lifestyle along with the prescribed medicine have to be continued and nothing else. And
Okay.
yeah, it is possible that a person can get a heart attack even after stent. See, because there might be disease which has developed in other portion of the vascular system, which can lead to heart attack. And even the stent which has been deployed, even in that there might be regrowth of calcium and cholesterol plaque, and it can cause again a heart attack. So it is
So
possible.
Karthik, yes, Karthik, that was an answer for your question. Next, I would want to take up a registered user's question, who's already has a stent put in the heart last year, but I still get chest pain. But the TMT report, heart is okay. What should I do?
So, if your TMT report is coming negative, so you should be assured and don't worry too much, and just check your risk factors and keep them in control. That's all you will require.
That's it. That's it. Just stay positive. I think that's more
Yeah.
important. You're
Yes.
एक बार surgery हो गया है, and then your system is being helped by an external factor, so you should be fine.
Yeah.
Yeah, Dr. Neerav Shah's question here. If there is a family history, according to you, that you stated that there's a risk if there's a family history, any precautionary medicine that one can start after the age of 40? Neerav's question.
No. First of all, again, I will emphasize that what is family history. Family history is when it is a cardiac disease which developed in a younger age, around 50 or young, 55, not 70, 75, 80. That is a natural phenomena. Second, there is no preventive medicine as such. There is a preventive lifestyle which we have talked in detail in last half an hour. That regular physical activity, avoid stress, smoking, and check your like cholesterol, blood sugar, blood pressure, keep them under control.
Right. So a lot of people are asking about 60-year-old plus, जैसे आपने बोला है कि blood sugar and cholesterol and pressure सब आप ध्यान में रखने के लिए जो आपने बोला है. विजय प्रताप सिंह जी पूछते हैं, hello sir, can you please tell us what should be a proper diet, and also I think we should touch upon a bit factor about diet. A lot of people are asking. Mother 60 plus and she suffers from hypertension and BP keeps fluctuating. She is a diabetic patient too. She had COVID positive last year. How do we take care of her heart health?
So, uh, co- one, COVID is playing havoc with people's metabolism and other things. And now we have a term called long COVID, basically.
G.
So long COVID is like somebody is COVID positive, he had symptom, then he had fever, pneumonia, cough, whatever it was, body aches, and then maybe in 5, 7, 10 days he has recovered, he has become COVID negative. But
G.
many people, they continue to experience fatigue, tiredness, chest issues and other issues, which we have now termed long COVID, because now we know that this COVID virus, it keeps dormant in body organs like heart, liver, kidney, gut. It 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 remains there, and it keeps continuing causing a problem. So one is that. Second, for diabetes, hypertension, regular medication, and checking regularly of these parameters, and keep consulting your physician every few weeks or few months if they are not under control. And
Yeah.
diet, because you mentioned what kind of a diet we should take to avoid these kind of things. So, Jhansi, first of all, I will like to clarify for the audience that there is no magic diet,
Exactly.
and there is no such thing that which will definitely cause heart disease and should be totally avoided. There is nothing like that. So, what we like, we should try to take 2 to 3 meals a day, which should be wholesome, like some
Mm-hmm.
amount of carbohydrate, some amount of protein, some amount of and low amount of fat, salt, and other things. So,
G.
like what we call do chapati, dal, sabji, thodi sabji, ya thoda sa bowl of rice, dal, sabji, some dahi. So, these kind of diet, because we are talking in Indian context, Indian diet, and then दिन में 2 या 3 सर्विंग फ्रूट्स की ले लें, है ना. One serving of fruit is like one apple or one banana. And
G.
then we should take 3 to 4 servings of vegetables. Vegetable, here we are not talking about what we call malai kofta ya shahi paneer. The vegetable should be lightly cooked, so that is considered vegetables, not the karari bhindi kind of a thing. It should be lightly cooked, or it should be raw, like in a form of salads. Cucumber salad and tomato salad and other salad, carrot and etc. And then low amount of salt, oil, and fat in the diet. That's all.
या तो ये जो हम लोग सोचते हैं कि घी है या मस्टर्ड ऑयल एंड ऑल द गुड फैट्स आर दीज गुड और बैड?
So there is basically all oils are same, and the problem is when we use these oils to fry something. So this is the frying which basically changes the character of oil.
जी.
So
The
we
high
can,
temperature.
yeah, and what we tell our patients, that you keep rotating your oil. There is
हाँ.
no, like, some people will swear by olive oil, some people will swear by safflower oil, some people mustard oil, but you can keep changing. 1 month one oil, other month other oil, third month, yeah. And then talking about desi ghee. So now we know that desi ghee is not really bad for us. We can use a small amount. The people who like to put it on their chapati, and people who like to put it in their dal. So half, 1 teaspoonful, 2 teaspoonful in a day is really not bad. Rather, it might be even helpful or beneficial.
So but वो हर मील में नहीं. Let us also put
Yes,
that, not in every meal.
yeah. Um,
Yeah. So, Rendra, I think your question is answered. All the oil, ghee questions, I think doctor's answered. So, very valid point you have mentioned. Let me quickly summarize it in Telugu for the audience who are watching it in Andhra and
yeah,
Telangana.
sure.
డాక్టర్ గారు ఏమన్నారంటే ఆహారంలో ఒక మ్యాజిక్ ఆహారం లేదు, అంటే ఇది హార్ట్కి చాలా బాగా ఉపయోగపడుతుందనే మ్యాజిక్ ఆహారం లేదు, అలాగని ఇది హార్ట్ని డ్యామేజ్ చేస్తుంది అని చెప్పగలిగే ఒక రాక్షస ఫుడ్ కూడా లేదు. బట్ ఏం చేయాలంటే మోడరేషన్లో తినాలి. మీ ఆహారంలో అన్ని వర్గాల భోజనం ఉండేట్టు చూడండి. పచ్చి కూరగాయలు, కూరలు, ఆకుకూరలు, పండ్లు ఎట్టి పరిస్థితుల్లోనూ తీసుకోండి. అలాగే వేపడము, ఆయిల్స్లో విపరీతమైన టెంపరేచర్లో ఆయిల్లో వేపినటువంటి ఆహారానికి ఎంత దూరంగా ఉంటే మీ ఆరోగ్యం, మీ గుండె ఆరోగ్యం అంత బాగుంటుంది అని చెప్పారు. ఎస్ డాక్టర్. సో ఎస్, ఆల్సో అబౌట్ ఘీ, ఐ ఫర్గాట్ టు మెన్షన్ అబౌట్ ఘీ. నెయ్యి తగు మోతాదులో తీసుకోండి, అంతకు మించి తీసుకోకండి అంతే. అలాగే ఆయిల్స్ ని కూడా రకరకాల ఆయిల్స్ ని మార్చండి, ప్రతి నెల ఆయిల్ మార్చండి. Great, doctor. So, doctor, here is a question about Rahul, who has done CABG. How many years of life expectancy can we expect after CABG? Is this question. He's not given me any
So,
other
uh,
details.
yeah, Rahul, if you take care of the risk factors and keep in check cholesterol, blood sugar, blood pressure, don't smoke, and don't take stress, and do a regular exercise. So life expectancy is equivalent to the one person who has no heart disease. So it is normal
Gee.
basically. Yeah.
Yeah. Yeah, great, sir. Here's Rajdeep Anand's question. Age 67, diagnosed CAD and angioplasty done Apollo Delhi में किया है, but my father is sweating too much. 67-year-old father है इनके. Even 6 months after angioplasty, no pain in the chest.
So uh, there are some people who are habitually found to be sweater and they sweat more, but I think you should consult and come and consult and check out with an endocrinologist for blood sugar, maybe thyroid issues might be there, and then you can get a even stress test to check whether the stent is okay or there might be a blockage developing again in the stent, because it is the first 6 months which are crucial, that if there is a blockage which re-happens in a stent, it happens usually in first 6 months actually. So if the first 6 months to 1 year are okay, then the stents they really don't get blocked that often.
Yeah, great. So खुशबू शेख जी, आपने काफ़ी बार आपके क्वेश्चंस यहाँ पर टाइप किए हैं, बट अनफॉर्चुनेटली डॉक्टर मुकेश गोयल जो कार्डियोथोरेसिक सर्जन हैं, वो आपके न्यूरो रिलेटेड क्वेश्चंस के बारे में आंसर नहीं कर पाएंगे. बट इफ़ यू रिक्वायर एनी अदर हेल्प, अपोलो 24/7 में अदर एक्सपर्ट्स भी है, सो वी विल नॉट बी एबल टू टेक योर क्वेश्चन हियर इन दिस. ऑलराइट, नेक्स्ट क्वेश्चन इज सूरज एंड सिंगल जी, दोनों हार्ट रेट के बारे में पूछ रहे हैं. एक का रेस्टिंग हार्ट रेट काफ़ी लो है, दूसरे का काफ़ी हाई है. सो रेस्टिंग हार्ट रेट क्या बताता है डॉक्टर?
So the resting heart rate can be between 60 to 80 and sometime even below 60. Resting heart rate is generally lower in athletic people, so who do
Who's
regular the athletic people, they generally have low
athletic
heart
people?
rate.
Okay.
Like
हाँ.
even President Bush, he had 60 resting heart rate because
Right.
yeah, he was into physical fitness and regular physical activity. So it can be normal. And the other kind of a low heart rate, people who are not usual doing exercise, and when the heart rate is low, and they have symptoms like syncope or the loss of consciousness because of that, so they might be suffering from heart block, and they might need a pacemaker to set their heartbeat right. And high heart rate can be because of many factors, like in fever the heart rate generally goes high. If the person has uh, thyroid issues, so it can lead to and the person has anemia like low hemoglobin level, there is a deficiency of hemoglobin in the blood, so they might also cause anxiety can cause high heart rate. And then if
जी.
a person is deconditioned, not doing any physical activity at all, so they are also having high resting heart rate.
Okay. So quickly, doctor, what are the tests that we can get done, and ECG का क्या मायना होता है? Dilip is asking, Mr. Dilip Rath, ECG positive है इनका since 2003 and and it has become negative subsequently and now 63-year-old. Do I have to consider I am at risk? तो ECG क्या बताता है and कौन-कौन who all have to get an ECG done and where?
So ECG is part of an annual health check when a person who is above 35, men and women who are more than 40 years, they should opt for an annual health check. So where they check your hemoglobin, where they check your blood cholesterol, blood sugar, blood pressure, and then they do ECG. They do a stress treadmill test, that is ECG while you are running on a treadmill, and these kind of test annual checkup should be there, so that we
जी.
know that everything is remaining all right. So your one test today is okay does not mean that there will not be a problem in future. So that's why we advise annual health check for that.
Yes. Yes. So ECG annually करना चाहिए and after age of 40. And for example, दिलीप जी ने पूछा है कि 63-year-old है, पहले पॉजिटिव था, उसके बाद नेगेटिव हुआ है ECG, but is he at risk?
Yeah, definitely every person is at risk of heart disease. No person is immune to it. First of all, we should keep in mind, we cannot
Yeah.
tell that you are at risk and you are not at risk. And that's
Hmm.
why annual health check is important for everyone.
Yeah. Yeah. Mr. Ankur Dalmia, quickly आपका question एक बार फिर से type कर दीजिए, please. I've lost your question in the lot of thing. And then yes. So everybody अगर risk में है तो quickly annual test में heart health के लिए क्या-क्या test लेने चाहिए? One quick roundup, please, doctor. Shmriti is asking this. What are the
So
tests and
there is a almost all hospitals now they run annual health check program, and basically they check for blood cholesterol, blood sugar, kidney function, liver function, hemoglobin level, blood counts, and then they do ECG, resting ECG, and then they do a stress ECG, like that they keep taking ECG while you are running on a treadmill for 8 to 10 minutes, and then they check that
yeah.
whether while on treadmill you get any symptoms or not, or whether there are accompanying changes in happening in ECG or not. So these are basically, and then depending on the person history and other things, the other tests might be added. But these are the basic tests which are done annually for and recommended for all the persons.
Yes, doctor. Thank you so much. And these tests can be ordered on Apollo 24/7 app as well. And MKJ Vlogs 21, this person name nahi diya hai, but age is 36-year-old. Mitral valve was operated in 2000. I have atrial fibrillation. What precautions do I have to keep in mind? I'm on medicine, Calactin, Acetrom, Lanoxin, and something else, doctor.
Yeah.
Yeah.
So the only one thing is that every 2 3 years he should check the status of his heart and valve with an echo. Every 2 to 3 year, one echo will be should be okay. Second, he
Hmm.
has to maintain his acetylene dose and constantly check his parameters of what we call prothrombin and INR, and ensure that it is in the desired range. And third, with calaptin and lenoxin, he should keep check on his heart rate and should try to keep it below around 80 or below.
ओके ग्रेट सो अंकुर दालमिया जी का क्वेश्चन था इंडाइजेशन डज इंडाइजेशन लीड टू हार्ट अटैक तो ये आपके आपने अब पहले भी बता दिया है बट लॉट ऑफ पीपल आर आस्किंग अगेन गैस एंड इंडाइजेशन के बारे में दिस वेरी इलेबोरेटली डॉक्टर हैज स्पोकन इन द इनिशियल फेज you can go back to the recording and check but doctor quick summary about indigestion gas and heart.
So the question is basically the question is framed a little differently.
Exactly indigestion
Indigestion cannot
can
lead
it
to heart attack, but it can be it can be confused with heart attack, or heart attack can be confused as indigestion. So the person might consider it only indigestion when in actually it is a heart attack which is happening. So whenever
oh.
someone has indigestion, so he should check and rule out an heart attack actually.
Great. So, Doctor, here's Pratik, who's a 30-year-old, recently facing shortness of breath and higher heart rate while playing badminton. Can this be an indication of heart disease or anything else? And he plays badminton quite regularly.
So if he was playing badminton regularly and he was not getting these kind of symptoms, but now he is getting these kind of symptoms while he is exerting at the same level, so he might be developing some blockage in the arteries, and should check his heart for blockage.
Yes, yes. So pulse rate का एक last question ले लेती हूँ. Dr. Vandana Sonu and Shravani, both of them are asking. Vandana Sonu's daughter is 30-year-old, has very high and very low heart rate in resting and exercise phase respectively. What should be the reason and any tests that you recommend? And Shravani is asking, 29-year-old pulse rate is 100 BPM and low BP 90 by 70 palpitations. Is there a heart risk?
So first, Dr. Vandana's question that if his daughter is having a low resting heart rate and which becomes high in exercise, so that is a natural phenomena. With exercise, the heart rate is supposed to increase, and what we say that one should, if one is doing a regular exercise, so what should be the target heart rate he should achieve, so that we know that he has got a good cardiorespiratory workout. So the formula is 200 minus age. So
200
200
minus 8.
minus age. Ah. So if a person is 40 years old, so the target heart rate is 160.
160.
So up to 160, if he goes, so it means he's in a very good cardiorespiratory health. And so that is a natural phenomena. And if the resting heart rate is low, that is because of maybe she is exercising. So her heart is in a very good condition. So the resting heart
Great.
rate is low.
So not to worry,
Second,
Vandana.
yeah, the
Shavni,
second one,
29 years,
Jan.
100 BPM. BP is low always and having
So,
palpitations.
first of all, we should understand that there is no low blood pressure. Low blood pressure, if it happens in a person who is sick, is a very fatal condition. So, the other person who are having lower than normal blood pressure, that is a good thing for them. That they don't have a high blood pressure. The high blood pressure is the problem basically. Second, high resting heart rate is maybe because of the deconditioning. She's not getting enough physical exercise, or she might be little anxious all the time, or she might be using a lot of stimulant in the day, tea, coffee, maybe sugary drink, cola drink, and all these things, which can itself lead to a resting high heart rate.
Great. So quickly, doctor, we will conclude this session with, can the blocks which are leading to a heart attack, which can be causing, can they be removed by medicines and then usage of aspirin and other blood thinners? A lot of people have been asking here.
So once a plaque is there, we cannot reduce it, though we can try that it does not progress further. Number one. Number two, when the blocks are there and up to a 70% blockage, we don't do any stenting or a bypass. It is only beyond
Hmm.
75-80% of the block is there, and the person we is having symptoms because of that, then we do what is appropriate.
Gee, gee.
Third is that we always attack risk factors which can halt the progress of this plaque and maybe prevent many heart attacks because of the sudden rupture and blood clot formation on that plaque.
Right. So, very valid information that you have given us today, Doctor. I would want you to give me top tips before you leave. Due to paucity of time, I'll not be able to take up a lot of other questions, but then you have answered similar questions earlier. People who have joined us late or who require their answers can consult Dr. Mukesh Goel on Apollo 24/7 as well. And also, this recording will be available for later. You can please go ahead and check. So thank you so much, Dr. Mukesh Goel, for this wonderful time. And before you leave, one quick roundup and top tips to prevent heart attacks.
So always keep in mind what are the risk factors for heart disease. One is our lifestyle. sedentary lifestyle is a major risk factor. Then stressful life, whether at home or whether at office, and use of smoking, drug abuse, and then high blood cholesterol level, uncontrolled blood sugar, and blood pressure. So these are the risk factors we should try to control. We should check for these risk factors regularly. And uh, what are the measures we can take? No, first of all is our diet. Our diet should be wholesome and mix of carbohydrate, protein, fresh fruits, vegetables, and a very low amount of fat, salt, and other things. Second, we should always indulge in regular physical exercise, 35 to 40 minutes at least 5 to 6 days a week. And exercise like brisk walking is enough. Brisk walking, swimming, anything is good. And by brisk walking, we mean like 5 to 6 kilometer speed in an hour. That is called brisk walking. And immediately quit smoking if and be away from smoking. Try to control the stress, indulge in meditation, yoga, whichever makes you more calm, and regularly check your blood cholesterol, blood sugar, blood pressure, and keep them under control. So that is for us. And if someone is experiencing that he might be having a heart attack, please don't do anything. Just calm down and call for help. Tell any person who is on your vicinity to call for help, and just calm down and take rest. Don't do anything stupid. So, and I will wish everyone a good day and have a healthy heart and healthy life.
Thank you, thank you, thank you, thank you so much. Always a positive session that we have when you reiterate that lifestyle can be modified and heart can be protected. Thank you, Dr. Mukesh Goel, for this wonderful time on Sunday morning.
Thank you, Jhansi. Have a good day.
Thank
Bye.
Yes, and a lot of people are thanking you, Doctor. Mr. PB, who has joined from Ramantapur Ganesh Nagar Community Center. Thank you so much for joining and asking these valid questions. One last question that you asked about women and men case symptoms, how different are they? We actually had done one earlier session. We'll leave a link somewhere down there. How women and heart attacks can be prevented. Yes. So now it's the chance for you to win prizes from Apollo 24/7. How to prevent heart attacks. ये हो गया था. अभी आप आंसर कीजिए. आज के सेशन में हमने थोड़े टिप्स भी दिए हैं, तो you can be answering these questions quite easily. Please answer these questions if you want to participate in the quiz only on YouTube. Winner's name will be announced towards the end of the show, and if you are announced as a winner, you have to write back to us at marketing@apollo247.com with all your contact details, and gift vouchers will be shared with you. Winners will be selected at the sole discretion of Apollo 27 team. ये रहे आज के आपके 3 questions. The 3 questions are on the screen. Question number 1, true or false? Heart attack and cardiac arrest are the same. Yes or no? True or false? Heart attack and cardiac arrest, are these the same? True or false? And question number 2, fill in the blank. Broken heart dash feels like a heart attack. Fill in the blank. आज इसके बारे में हमने काफी बात किया है in the initial sessions, both question 1 and 2. You'll find the answer in the initial session of this today's live session. Broken heart dash. S के साथ शुरू होता है this word. Does it feel like a heart attack? It does feel like heart attack, but what is it? Complete the sentence there. Question number 3. What time is KBC season 14 aired on television? What time is KBC कौन बनेगा करोड़पति season 14 aired on television? बस आपको टाइम बताना है हमें. Yeah, true, false, yes, broken heart, dash, yes, Gaurav Sood. आपने आंसर टाइप किया है. So let's see who the winners are for this week in a short while. In the meanwhile, let me give you away the discount coupons. The first discount coupon that we are giving away today is First VC. Use this code on Apollo 24/7. You get direct from Apollo doctor consultations, and you get flat 150 rupees off on the first online doctor consultation. The code that you have to use is First VC. And the next code that we are giving is you get up to flat 25% off when you order medicines direct from Apollo on online medicine orders. The code that you use is First 3. FIRST 3, and of course conditions apply. The offer is valid on the first 3 online medicine orders and above 1000. So these are the 2 coupons, and exclusively Health Our viewers के लिए we are giving you this coupon. If you're new to the show, you can use this coupon, and the next time that you're using on Apollo 24/7 app में जब भी आप consultation करते हो या medicines order करते हो, use the coupon HH247. You get 199 rupees off on online consultations with Apollo doctors and up to 20% off on medicine orders as well. This is an exclusively coupon for Health Our viewers. So here we are waiting for our winners. While our team is getting us winners, I would want to bring your attention to the next week's topic. Next week, we are talking about a very, very important topic, depression, mental health के बारे में हम बात करेंगे. What causes depression? What is depression? How do we address this? And any other issues related to depression? We will bring you an Apollo's expert psychiatrist to the session. We'll talk about this. Join us next Sunday, that is October 2nd, 11 a.m. And you can ask all your questions. And today's winners, Gaurav Sood, Ankur Dalmia and Manjit Kaur. I repeat, Gaurav Sood, Ankur Dalmia and Manjit Kaur. Please write back to us to claim your gifts from Apollo 24/7. You have to write back to us at marketing@apollo247.com. All the details will be left in the chat box for you. Thank you so much for participating with your valuable questions. Thank you once again, Dr. Mukesh, and thanks to all the audience who have joined us. Namaskar, take care.